that showed up today. It's my pleasure to introduce Dr. Colleen Cowdery. Dr. Cowdery is the Chief Medical Officer for the Washington Poison Center, which is dedicated to the prevention and reduction of harm from poisoning. She completed her emergency medicine residency in Jacksonville, Florida, and her medical toxicology fellowship in Portland, Oregon. Before moving to Seattle to join family in the area, her professional interests before moving to Seattle to join family in the area. Her professional interests include the treatment of severe calcium channel blocker poisonings, the use of Poison Center as collaborators for medication-assisted treatment initiation in the emergency department, and mushroom poisonings. So thank you so much for joining us today and sharing your expertise, Dr. Cowdery. With that, I will pass it over to you. And if we can get folks to please turn their cameras off, I'd appreciate that. Thank you.
All right. Well, let's get going then. Super happy to be here. Thank you for that wonderful introduction. I'm Dr. Cowdery, and we're going to be talking about nitrous oxide abuse and misuse beyond whippets and wah-wahs. As I'm sure most of you probably know, nitrous is definitely not a new substance, but there have been some pretty significant changes in the past year for reasons that we will talk about. So, to start with, I have no conflicts of interest to bring up here. Our objectives are going to be to describe the overall epidemiology of nitrous use and misuse, some chronic and acute effects that are associated with using nitrous, what it generally looks like for patients who need to be treated for this, and we're going to look at some current legislation in Washington and around the country that is addressing nitrous oxide abuse. So for those in the audience who might be unfamiliar with what nitrous is, initially it was discovered as one of our first anesthetics. It has been used medically for almost 2 centuries, so it is very well understood from a appropriate medical use standpoint. It was used in culinary uses for making whipped cream, which was actually like a incredibly game-changing discovery in the world of food science. In the world of cars, it is used to temporarily boost horsepower. But what we are going to focus on is the party scene. This is used recreationally to create a very brief euphoria. So the way it does that, I'm not going to get into the specifics. Multiple receptors are involved. Euphoria might be from one receptor called NMDA, which all you need to know is it's sort of similar to ketamine, which you may also have some familiarity with. Creates a trance-like kind of floaty feeling out-of-body experience that has this auditory distortion, which can sound like whooshing or like a repetitive, like whoa, whoa, whoa sound, which is why one of the nicknames of this is wah-wahs. It, unlike many other drugs, is very, very quick to act, and it also fades very quickly. So were you to use nitrous oxide, effects start within seconds, and then we expect that those effects will last only seconds or minutes. And depending on the dose that you use, you might get different effects. If you use quite a lot of it, you might get a fully out-of-body experience. And somewhere between the trance-like floaty feeling and the out-of-body experience is what most recreational users are looking for when they actually use this substance. So what we typically, historically, have thought of as the usual dose for using nitrous oxide recreationally. These little silver canisters you see in the top corner there are chargers. Those would be attached to a little device in a kitchen and used for making whipped cream. If you take one of those chargers and you put it inside of this, the example one here is purple, which is called a cracker. And you crack that open with a balloon attached. 1 or 2 of these little silver canisters will fill a balloon. And then that balloon, each breath that you took from the balloon would give some nitrous oxide to you, and you would get a very short-lived effect with each breath. When the balloon is gone, your dose is done. Overall, you might get, 5 minutes of that trance-like floaty feeling. And this was traditionally the dose. We will talk about how that has changed, unfortunately. So let's talk about some epidemiology. First, I think it's important for us to talk about where nitrous is used these days. So originally used in the operating room as an anesthetic, then kind of moving locations. So it became a very popular recreational drug to be used on like concerts and dance parties. So jam bands were thinking like Grateful Dead, Fish, things like that. And when going into concerts, people would be selling balloons, which the phrase would be ice cold fatties. And this sort of came to light with the general public after some reporting around 2010, where nitrous was called hippie crack. And there were reports of people being very aggressive with their sales, but it was still very localized at concerts. That is very much no longer the case. And these little chargers are no longer so much what we worry about. Not being sold in these little 8-gram chargers, but in 2-kilogram containers. That picture right there was actually taken by one of the employees of the Poison Center like a couple days ago. And she saw that while out on a walk. That is a size 10 shoe next to one of those canisters. So what you're finding now in stores is brightly colored, they're flavored. They've got flavors like mango smoothie and tropical punch and vanilla cupcake and blue raspberry. Um, and they used to be very easy to find on Amazon. More recently, Amazon has taken down some of these large containers, but in the past few years, it has usually been pretty easy to find these online. Um, it's worth noting that kitchens, like industrial restaurant kitchens that need to use a lot of nitrous oxide for their business, don't buy flavored nitrous. They buy unflavored nitrous so that they don't accidentally like mix in flavors to the thing that they're making. If they want to make a like mango like whipped thing, they will add the mango flavoring and then add unflavored nitrous. So from things that I have read from professional chefs, the addition of flavors is really not a like a culinary thing. It is for recreational users. Uh, Interestingly, that these big canisters, the company that really kind of blew that up was a company that you may or may not have heard of called Galaxy Gas, that was founded in around 2021, went viral on TikTok around 2023 or 2024, and their sales exploded. And shortly thereafter, the phrase Galaxy Gas is now blocked from TikTok because of the amount of sales that were happening through social media. They claimed that their products were only for culinary use, despite the size of the containers, the fact that they were flavored, and the fact that the bulk of their sales were to smoke shops. As of the end of 2024, they have paused sales, but unfortunately, a number of other companies have taken over in their place, as tends to be the case once a market exists. So who is actually using nitrous? In the US, unfortunately, inhalational drug data is lumped together. So any inhalant use is like 1.1% of people in the National Survey on Drug Use and Health for like 2021 through 2023, 1.1% of the population said there was any inhalant use. Um, about 5% of the population maybe has used it ever. This is a, a rough number because it's really hard to do these surveys and, get that data. But moving forward from 2021 to 2023 up to 2024, we got a little bit more specific data, and it looks like there's actually a little bit more lifetime prevalence with older folks than younger folks. That could just be because they've been alive longer, and since we are looking at lifetime prevalence, that might be the reason there. Interestingly, in 2023, there was a French study specifically looking at healthcare students who would have access to nitrous through their job, and found that more than a third of these students had reported ever using nitrous, and almost 7% of them actually met a substance use disorder for nitrous. So I don't know that this study has been replicated in the United States. I also am not sure that there is as much nitrous access in the United States for healthcare students, but certainly concerning. And this is certainly not an issue only in the United States. So let's look at some poison center data. This is calls to poison centers regarding nitrous. And you can see that for 2023, 24, and 25, this has definitely been going up. Interesting, this spike here. This line right here is September to October of 2024. This is when Galaxy Gas suspended their sales. There was quite a lot of negative press and questions about their practices before they stopped selling. And after they stopped selling, there was a sharp decrease in calls to the poison center. But unfortunately, there are other companies that have sort of taken over with names like Extra Whip and Infinity and Cream and, again, giant brightly colored flavored canisters that contain, 2 kilograms worth of nitrous rather than those little 8-gram chargers. So the genie is sort of a little bit out of the bottle, even though Galaxy Gas has stopped selling. Looking at one poison center in particular, this is from Michigan. This is looking at poison center, emergency department, and EMS responses, and all of them are seeing this same drastic increase in encounters related to nitrous. So this is definitely an issue. So let's look at some of the actual toxic effects of this. So it's, I think, important to kind of divide this into acute effects and chronic effects. Acute effects, we're thinking about immediately after the use of nitrous. You might see difficulty walking, feeling like your heart's going fast, some confusion, a headache, fall. Most of these effects are actually associated with briefly not having enough oxygen because you have stopped breathing oxygen and you are now breathing a gas that contains no oxygen. Some deaths have been reported related to acute use, and most of those have had to do with either drowning or trauma, such as if you pass out while you are in water, it's a bad place to pass out, or if you pass out while driving a car. But overall, very, very acute use it doesn't have a lot of death-related data. However, in the past couple of years, there actually is emerging data that there might be acute clotting risks associated with even short-term use of this. And we'll talk about that a little bit more in a few slides. But we're looking at pulmonary embolisms and clots in the brain. So these are deaths that have been associated with nitrous oxide from 2010 to 2023. Interesting, I remember that I showed you that big spike in use started in 2023 when we were looking at calls to poison centers. So I really wish we actually had a couple more years of data, but unfortunately, this study that was recently published only went through 2023. I would be interested in seeing whether or not the deaths matched the increase in use that we have seen. So let's look at some of the chronic effects that we've more associated with the nitrous oxide deaths. Now, on the left side is some of the fancy doctor language of what you might see on an MRI. We don't really need to pay attention to that unless you are interested in doing so. What patients are reporting with their chronic use is difficulty moving, difficulty walking, numbness and tingling, weakness. And it's important to know that this isn't related to not having enough oxygen. These effects are actually related to damage to the nerves. Long-term use of nitrous through a bunch of mechanisms that I'm happy to talk about, but we don't need to, will cause long-term nerve damage, and you can end up paralyzed from chronic use. That's the nerve side of things. There's also effects on the blood system. Again, fancy doctor language on the left, but what patients are noticing is very poor exercise tolerance, that one arm or leg might have a lot of like swelling or pain. They might have severe headaches, shortness of breath. They can actually see seizures and really altered mental statuses and fevers. And that's coming from some of the newer data that's looking at blood clots. It looks like one of the effects of nitrous is that it actually leads to an imbalance called hyperhomocystinemia, a $12 word, that makes it so that your blood is very prone to clotting, and you can get clots in the legs or the lungs or the brain, where obviously we do not want clots. Just last year, a study was put out that actually described some of these blood clots, and that was one of the first published pieces looking at that. So still a lot more to learn, but this does look like a previously under-recognized toxicity from nitrous. So what can we offer for somebody who is facing toxicity from either acute or chronic use? Well, a lot of this is coming from issues with B12. Many patients who are chronically using nitrous have low B12, that's vitamin B12 levels. But it's really important to know that just taking B12 supplementation will not improve symptoms if people continue to use B12. This is a really great cutout from a website called dancesafe.org, which does some really good like harm reduction tips for people who are going to concerts or raves with the aim of them not having dangerous drug use. The issue with using B12 supplements while continuing to use nitrous, as they very eloquently point out here, is that the nitrous is actually inactivating the B12 before it can actually do anything useful to your body. So the most important way to avoid toxicity if you're trying to treat a patient is going back to the very fundamental concept of toxicology, which is the first thing you have to do is remove the substance that's causing the poisoning. So in this case, complete abstinence from nitrous. If you continue to use nitrous, giving additional B12 is not going to help that patient. Happily, unlike some drugs like alcohol or nicotine, there are limited withdrawal symptoms. The majority of the withdrawal is psychological, as with all addicting substances. So patients can still benefit from the same social and psychological support that we see for other addiction treatments, whether that's support groups, psychotherapy, things like that. But stopping the nitrous use is really the most important step. After it has been stopped, then we can really get benefit from vitamin B12 supplementation. It's a pretty significant amount of supplementation, and you can require more than 6 months of treatment. even with 6 months of treatment, recovery of those nerves is it's pretty slow. It can take weeks to months for patients' symptoms to get better, and patients may not ever get back to their original baseline, depending on the severity of the nerve damage that they experienced because of their use. And unfortunately, if you start using again, you can get recurrence of all of your symptoms. So obviously, use is going through the roof, and there's a lot of different toxicities associated with nitrous. So, what is going on right now for the legislation? Well, currently there's no federal regulations. In 2021, New York put in like an age verification that was needed. In 2024, Louisiana was the first state to completely ban retail sales with a carve out for like medical and culinary and automotive shops. And in 2025, a bunch of states added in new regulations. What about Washington? Well, there actually was a House bill and a Senate bill, both introduced. Um, this was sort of hand in hand with the Suquamish tribe, looking to ban retail sales with exemptions. The Senate bill didn't make it out of committee, the House bill did, and it is currently awaiting full consideration. So that could be a change coming around the corner for Washington. So, in summary, nitrous use is definitely increasing. Part of that is due to new companies offering much, much larger canisters. So people are with great ease exposed to much larger amounts of nitrous than they could have easily accessed 20 years ago. And the more you use, the greater the toxicity. So it's not surprising we're seeing a lot more patients who are experiencing toxic effects. The biggest toxic effects we see are neurological damage and some changes in the blood. Treatment is a lot of the same supportive stuff we see for other addictions, substance abstinence, vitamin B12 supplementation, and hopefully some new legislation coming around the corner to help curtail some of these large retail sales in smoke shops. Very happy to take any questions that anybody may have.
Thank you, Dr. Cowdery. Are there any questions? You can either put them in chat or feel free if folks want to turn their cameras on, unmute and ask. That's fine as well. I've seen nitrous being sold everywhere from, up in Spokane, up at the Garland Market. There's a neon, or not neon, but LED flashing sign outside that says, I think it says nitrous on it. It might say space gas or something like that. But
Mm-hmm.
all the way up to like Oroville, which is just this little tiny town up on the Canadian border. And, I think it's a two quick stop town and stopped into the quick stop there one day and noticed that was actually the first place I saw it about 2 years ago, year and a half ago,
Mm-hmm.
maybe.
Yeah.
But I was, kind of surprised.
Yeah. I think if we look back, 20 years ago, nitrous was really, I think, being abused by a much, much smaller audience of people. There were people who were using it at concerts and people who had, access to it at work, but a much, much smaller portion of the population actually had daily access to this. And if you wanted to have a daily habit, you had to buy so many hundreds of these tiny metal canisters. Um, and now, if you could just walk into any, gas station, smoke shop, or just get online, there's any number of these companies that will sell you a, 3 liter, 2 kilogram canister. And if you buy, four of those, you are well on your way to causing yourself some really significant toxicity. So the barrier to entry has really, really dropped. And I think that is in large part why we're seeing this huge influx of people with significant toxicity from nitrous.
I had a question. Amanda Duggar here at Spokane Regional Health District. Part of my work, I work with youth and families, and I have those conversations, right? Not only with the youth,
Mhm.
but with parents and caregivers. And so my question to you is like, um, how do you have that conversation? How do you give that awareness out, especially for parents that may not know that maybe their child or children have done this before, and like, or maybe they're looking at experimenting and such
Yeah.
things. Like, what kind of information, or do you have any of that?
I think that is a great question. I actually had a slide in here that I took out about perception. Um, Studies have shown that people perceive nitrous to be an incredibly safe substance. So a lot of people who are wanting to experiment don't have the same level of concern with nitrous as they might for trying meth or, trying LSD or trying ecstasy or trying fentanyl, where they've heard these stories about how dangerous these things could be. So maybe they would be a little bit more cautious about starting, or a little bit more cautious, with any part of it. But many people look at nitrous as, well, it only lasts a couple seconds and it's totally safe, or else the doctors wouldn't use it. Um, so I think for me, an important part of that conversation would be with parents, emphasizing that this is, now more than ever before in history, incredibly accessible to anybody, both through online sources and smoke shops. So if their child is old enough to get on the internet or to, like, visit a store by themselves, they could have access to this. And that it does have risks. It is not a, completely safe high. Using it both has those long-term risks, where a lot of the chronic stuff with the nerve damage we typically expect after like a couple months of heavy use. But that new data that's coming up about the blood clots is showing that people's homocysteine levels can get really deranged after just a few uses. So if somebody gets one of these big canisters and starts using it regularly, they're pretty immediately putting themselves at risk for the blood clots. So I would kind of try to emphasize to people that, it's not completely safe. Once you start using it, you are putting yourself at risk for blood clots that can kill you, or permanent nerve damage. And if you have friends that are using it, just because they have used it with no issues up to this point, that does not mean that they aren't playing Russian roulette. And, that is a real risk.
Thank you. And then just real quick, and then see if anybody else had any questions. But I mean, you talk about the little charger, you talk about the whippets and the balloon and stuff. But when it comes to that, people can still be using like the actual whipped cream can, right? Or
Yeah.
or the
Mhm.
dusting thing for your computer.
Yeah. Yeah. So the like computer spray, like the little spray cans that clean off your keyboard and things like that, don't I don't usually think of those as containing nitrous. Those can contain other substances that can get you high. Whipped cream canisters, you can certainly still just use what's in your fridge. So, if the parents are finding that, they shake the canister and it sounds like that, feels like there's still a lot of whipped cream in there, but there's no gas, then that would be a concern that somebody in the household is doing that. Um, but if that is the level of use, um, again, every like breath that you take of nitrous is only going to get you high for seconds to like a minute or two. So using an entire can of whipped cream is not going to get you that much high. If people were going to try, be developing a habit, they would be, the parent would notice somebody is buying 6 to 12 cans of whipped cream on a regular basis. So, access to an actual whipped cream canister might be a introduction to the substance. But if a teen or an adult was then looking to continue use in a more regular way, they probably would need to start going online or going to stores and buying canisters of whatever size.
Thank you.
Cool. And I just put a couple of resources in the chat from Amanda's first question. The first one is the nitrous oxide infographic from the Washington Poison Center that has some easily digestible information to help maybe guide that conversation. Also, when I do like naloxone, opioid, and stigma trainings, I always talk about how to talk to people about substance use, and I I mostly got a lot of my information, to be transparent, from the Friends for Life campaign, talking to teens about fentanyl. I think it's really useful. I encourage folks to look through that. And it's things like, ask open-ended questions, don't be judgmental, avoid stigmatizing language, come to the conversation informed, and to avoid using scare tactics. There's more in there too. I encourage folks to look through it there in case they do have questions about how to talk to teens about substance use. And also, uh, being a social worker, I've had to have a lot of, challenging conversations with people before that were pretty uncomfortable. And I think, like any topic, the more you do it, the easier it gets. It's not a one and done. I check the box and talk to my kiddo about substance use. It's that it's an ongoing conversation, right? And that trust is built, and that ability to be open is built as well. So just wanted to share those two resources because I found them to be really valuable. Do we have any other questions for Dr. Cowdery? So I know that people use the balloons when they're using the crackers, and so do they also use the balloons when they're using galaxy gas? And can you explain why that they may be doing that? If I may have missed it, if you already covered that, I was multitasking, but I'd appreciate that if you could, please.
Yeah. So if you're having the giant canister rather than the little ones, you no longer need the device I showed you where you kind of twist it in and it cracks it open and fills it up. You don't need that anymore. The canister comes with a little dial from I've never used one myself, but from what I understand, many of them are not incredibly well manufactured. So once you open it, even when you close it, there's still sort of a slow leak. And so once you open a canister, you can't just put it away for, 3 weeks and then come back to it. You're kind of like using it until it's gone. I think people are still, you are able to just breathe directly from the canister because you can a little bit control the speed at which the gas comes out, but some people still prefer to use a balloon on that because then they have more control with the breaths and don't feel like they're getting like blasted in the face. I have had patients who I have taken care of who had actually some frostbite injuries around their mouth or inside of their throat because I don't know if anybody is, getting flashbacks to like high school physics. When a gas expands really quickly, it gets colder. And so you have like a compressed canister. And then if you open it up and, breathe directly in, that gas is going from super compressed inside of the canister to expanded in the back of your throat. And so you can actually get frostbite, which is another reason why some people prefer to use the balloon as a transit device. But you don't have to.
Okay, great. Any other questions? It sounds like the kind of paraphernalia to look out for would be crackers, canisters, and those. I was surprised at the size of the size 10 shoe next to the Galaxy gas container. They
Yeah.
must be about 14 to 16 inches or so. They're quite large, huh? So
Yeah.
if no one has any other questions, one last call for questions. Okay, well, we'll wrap it up. Thank you so much for joining us today, Dr. Cowdery, and sharing your expertise with us.